All right, so we've reached the last of our heart blocks for this semester, and this is second degree heart block type 2. In fourth semester, you'll learn about third degree heart blocks, so we'll save that one until next semester. So one of the ways to remember second degree type 2 is to remember if some of the P's don't get through, well then you have Mobitz 2. In second degree type 2 heart block, aka Mobitz 2, is always a disease of the distal conduction system, the His-Purkinje system. This delay is a little bit worse than our second degree type 1, the Wenckebach. Why? Because it's a little closer to slipping into that third degree heart block, aka complete heart block, which is super serious. The biggest indicator that sets this block apart from all of the heart blocks is the little P wave. Some of the P waves are not going through the His bundle area, and so they get through that AV node, but they don't make it down through the conduction system into the ventricles. So basically the charge is just not getting down into those ventricles. So guys, remember, if some of the P's don't get through, well then you have that Mobitz 2. All right, back to our 5 steps to interpret this EKG rhythm strip. Step 1, the rate. Remember, count those QRSs in this 6-second strip, multiply that by 10, and in this case, you should have 60 beats per minute. Step 2, we're looking at the rhythm. In this case, we see P waves, they're regular, they march out, but the QRSs are not. That R to R peaks are not even. So this is regular Ps, but irregular QRSs. In step 3, our P waves, we have too many. There are more P waves than QRSs, but we do have P waves. They are upright. And then in step 4, our PR interval, when we see it, we calculate it. And in this case, we have PR intervals before the QRSs that we can calculate. And when we look at the small boxes, we see 0.16 seconds, guys. That's right, 0.16 seconds on this calculation. And then step 5, our QRS complex. When we look at those small boxes and calculate our QRS complexes, we should see 0.06 seconds. So what do we have for this EKG interpretation? Well, guys, this is second degree heart block type 2. All right, just like all of the other abnormal rhythms and normal rhythms, you need to know what are the normal parameters for second degree type 2. You should be writing this down for this rhythm as well as for the others. So when we're calculating rate in second degree type 2, we will see that the atrial rate will be faster than the slower ventricular rate, leaving more P's than QRSs. As far as rhythm, we'll see the rhythm will be regular for the atrial or for the P waves, but irregular for the ventricles or QRS waves. The P waves, we will see P waves that are normal, they're upright, but there's too many. There's more P waves than QRSs. For our PR interval will be normal or slightly prolonged. It varies based on where the P waves are located. And then our QRS, usually a little bit wider because the ventricles are taking a little bit longer to contract, but that's not always the case, guys. We may have fairly normal QRS complexes in second degree type 2. So what's going on here? Well, as you know, the heart has one main pacemaker and two backup pacemakers. The SA node fires, but the conduction system fails to conduct the impulses all the way down through the ventricles. The block is below the bundle of His, and this arrhythmia is more serious than Mobitz type 1 or Winky block because it may progress to third degree heart block. Third degree heart block is complete heart block, a medical emergency, and it's also considered lethal arrhythmia. Ischemia and degenerative diseases of the conduction system are some of the causes, and our treatment, this would be treated aggressively with a temporary and then a permanent pacemaker if it doesn't resolve. And just like all ugly cardiac dysrhythmias, the heart's not pumping correctly, so that means less or lower cardiac output, which means less or lower oxygen to the body. And we see classic complaints like in collapsed. One thing to remember, if we have first degree all the way down to third degree, is that the signs and symptoms we're going to discuss right now, they get a lot worse as we move towards third degree. These signs and symptoms will not be as apparent in second degree type 1 and second degree type 2 as they will be in third degree, but they get progressively worse as we move through the different types of blocks and get closer to third degree heart block. We can remember signs and symptoms by the acronym COLLAPSED. So let's run through these because they all stem from either low oxygen, low cardiac output, and possibly even clots. So C is for chest pain, O is for oxygen or low oxygen saturation, the L is for low P or pressure called hypotension, and even tachycardia, and we're talking heart rates over 100. The L is for lethargy, A for anxiety, P for palpitations. Often patients describe a racing heart and gallops in the chest. S for shortness of breath. E for elevated ventricular rate or heart rate. Usually classic signs of AFib or tachycardia, but sometimes it can be low, between 60 and 100, especially if we see the patient on a beta blocker or a calcium channel blocker. And then D for dizziness or syncope or fainting. So as always, we have to ask ourselves, what are we going to do about it? It's not just good enough to analyze and interpret the rhythm. We have to determine what interventions need to be done. In this case, we ask ourselves, what is our main patient goal? Well, it's to reset and restore the AV node normal electrical function. So the first thing we're going to do is remove the cause by stopping or decreasing the dose of medication that may be affecting the heart rate. That's beta blockers, calcium channel blockers, and digoxin. These are all negative chronotropic drugs that decrease the heart rate. Now, if that doesn't fix the heart rate, then we need to stimulate that AV node. We can do that by giving atropine 0.5 milligrams IV to increase the heart rate, dopamine to increase the blood pressure, then epinephrine to increase the heart rate and blood pressure by vasoconstricting or squeezing down those blood vessels, which increases cardiac output and provides that necessary oxygen to the heart and brain. Now, if that doesn't work, we're going to have to replace that AV node with a pacemaker. A pacemaker will maintain that electrical impulse that our body is failing to do. All right, guys, that wraps up our heart block for this semester. We have gone over first degree heart block, second degree heart block type 1 or Winkie-Bach, and second degree heart block type 2 or Mobitz 2. When you get into next semester, you'll learn about third degree heart block, which will complete all of the heart blocks. But for now, we're just looking at first, second degree type 1, and second degree type 2.